In terms of sort of modern clinical science and psychological therapy, shame rather than guilt, we now know, is a significant risk factor for the onset and maintenance of a number of different psychological difficulties. And this is Michael Lewis in 1992, and it was kind of a reference really to Freudian instinct theory, and it said that shame, more so than sex and aggression, is responsible for controlling our psychic course. Shame guides us into depression or antisocial behavior. Our internal struggles are not battles between instincts and reality, but conflicts that typically involve the understanding and negotiation of shame, its solicitors, and its frequency. The experience of shame is intimately connected with a whole raft of different psychological presentations, uh, personality disorders, and in particular borderline personality disorder. But you'll see heavy doses, if you will, of shame in things like dependent and avoidant personality disorders. The dissociative disorders, dissociative identity disorder, for example, usually people with that presenting problem have high levels of shame that they are doing their best to regulate. It's highly prevalent in complex PTSD and PTSD, highly prevalent in social anxiety and depression, in OCD as well, and in eating disorders. So I'll just turn attention now to dissociation and shame. So what we've done up so far is to think about shame and some of its psychology, some of the aspects of it that are really relevant in the room, and maybe some of the ways to think about treatment, including the therapeutic stance that we might want to take moment to moment, which is going to shift from being on the side and validating shame and really understanding it, to being more neutral and curious about it, to being against it, if you will, challenging it as a person starts to get some separation from that experience inside. Then we looked a little bit at dissociation. Now what we're going to do is put these two things together, just wrap this little bit up. So we've looked at the idea that shame can lead to dissociation, dissociation can lead to shame, and that these two things actually might have a bi-directional relationship, which then has an impact on other forms of functioning, like functioning in relationships.